Hello, a very good morning to all of you. A warm welcome to this webinar on anxiety. I am Dr. Madhukar, Medical Director and Consultant Psychiatrist with the Cadabams group, and I have with me Dr. Priya Raghavan, Consultant Psychiatrist.
Good morning, Dr. Madhukar. Good morning, everybody. Welcome to this webinar where we are going to be discussing a very commonly occurring topic, that is anxiety.
We have with us, in fact, 4 speakers for the morning. Myself, I'm going to speak about the science behind anxiety, and Dr. Priya.
I will be speaking about how to manage anxiety, specifically focusing on treatment of anxiety.
We also have Mrs. Suhita Saha, who is going to be distinguishing between everyday stress and anxiety, and Neha Cadabams, who is going to talk about managing anxiety. Now, before we start the actual webinar topic as such, why should we be talking about anxiety in the first place?
Yeah, it is something that occurs very commonly, isn't it, Dr. Madhukar? Much more commonly than we think. Generally, they say about 14% of the population will have anxiety at any point in time. But we also know that there's a lot of hesitancy in seeking treatment, or in fact there's a lack of awareness on recognizing anxiety itself. And I think that's what we aim to do today, try to help you recognize signs of anxiety and maybe speak a little bit about the treatment and overall management of it.
Absolutely agree with you. Who hasn't gone through anxiety? All of us have at one point or the other in our life.
Yeah.
And before we get to the webinar topics, we would like to thank Mr. Sandesh Cadabams, Dr. Sunil, and the entire staff of Cadabams for arranging this webinar. I think as laypersons or as professionals, all of us would have had these questions about anxiety. Now, just looking back at my own professional career, I remember during my first year MBBS, anatomy exams, we all know, and the question paper was given. For the first half an hour, I had gone totally blank.
Yeah.
Knew nothing what was going on.
Yeah.
And saw my classmates all started to write and take papers and more.
Yeah.
So for half an hour, totally gone blank.
Yeah.
Knew nothing what was going on, so I had to recollect what I had read, and then luckily I passed that exam.
Good, that sounds like a big panic attack there. Did you pass the exam, Dr. Madhukar? That would be…
Well, it may surprise you, I got a first class too.
Oh, that's brilliant. So that's one of the reasons why we have Dr. Madhukar sitting here. He's a very bright psychiatrist from his days. So the other thing I wanted to mention about anxiety, I know that's a very common thing that happens. You're put in a spot, you're put in a situation, your mind goes blank, something that happens to many of us. And that sounds a bit like a panic attack, especially when you have physical symptoms, isn't it? Like palpitations, churning in the stomach, etc.
Absolutely, yeah.
But also to speak about the pandemic in recent times, how many people, Dr. Madhukar, have we seen who have had anxiety in our clinics? So many have come through the doors.
Absolutely. I think starting with February or March itself, when the whole world started seeing new cases, and more so I think it hit us over here once the lockdown was announced.
Yeah.
And I think after that, where lives have been restricted, even to this day we get to see people who have experienced and who are still going through the anxiety. And I don't think in our lifetime we have not seen a situation like that, where people all over the world, being a pandemic, we were exposed to a real situation, a threat, a real threat as to what may happen, how our professional, family life, everything was restricted.
Absolutely. So extraordinary situations have called for many people actually developing significant anxiety symptoms and walking through the doors of our clinics. But to have a degree of anxiety beyond this, which doesn't require treatment, is again totally understandable. So I think we should maybe speak a little bit about what is the science behind anxiety. What is it that causes anxiety?
Yeah, I think it's important to understand the science. We all know that we need a stimulus, something to keep us going. You know, we need a purpose, we need to have a drive to probably get us to be active, to look into how to handle. So, a bit of stress is important in our life. At the same time, if something which is far more as in the body or the mind feels that it cannot manage, then the way the body responds, you look at it as to what may have gone through. And we all know the brain is the seat, is the seat of all our thinking, our emotions, and what goes on. The control of from head to toe is all in the brain. Now, broadly classifying, you have the sympathetic system as well as the parasympathetic system. Now, if you look at it, any organism, be it a small fly, be it a rat, whatever, when you see on a day-to-day life, the first thing, if it is threatened, what would it like to do? It gets, you know, there is that fear, what will happen, can it survive, can it overcome that stress, be able to fight it off. No, so what you have is, you know, you have your brain, you have probably this is, you know, the explaining about the anatomy and the physiology of the brain, where you have the hypothalamus as the center for the thinking and the emotions, and you have the pituitary and the adrenal glands as such, which the three of us put together, you have the hypothalamo, pituitary and adrenal axis. Now, to simplify it, you have any external what is going on, the mind or the brain is able to see that what is going on. Now, that will send some signals to the rest of the brain as well as the entire organs inside in the body. So, you have to prepare yourself to fight it, you have to prepare yourself to handle that. Now, that is where the sympathetic system comes in too. Now, you have the connections, the brain, the spinal cord, then subsequently you have the connections to the heart, the respiratory system, the glands and everything. Now, it is important how the body itself prepares to fight this, So, you have the as far as the sympathetic system becoming active, probably overactive to the extent of sudden release of chemicals. Now, when we talk about chemicals, they are all required even in normal levels also to get all our organs to function. However, in a threatened situation, there is an overdrive of this system. The heart starts, just to give you an example, the heart starts pounding. Now, I was explaining about exams and you talked about panic. So, what happens? The heart starts pounding, it starts pumping much more vigorously. Now, that is, and so has to pump the blood to entire body much more faster, and you start feeling the warmth in your body. You know, you start feeling, and the glucose that also starts getting utilized much more. So, they may be sweating, they may be shaking, you know, muscle tension, which can also happen, and you start, you know, the muscles, including the restlessness, agitation, which can all be part of the sympathetic stimulation as such. Now, till that threat is diffused, the sympathetic system continues to be overactive, continues to be active. If the body feels that yes, the threat is over, then it returns to that equilibrium. However, in certain situations like the pandemic or what we had, the threat has continued. So, our body arousal system adjusts to a new equilibrium, which is about the higher levels. So, we may be left with reduced sleep at night and feeling anxious all the time. Okay, so that we are unable to relax, we are thinking, worrying at all times. So worrying at all times about what? Negative things. What may happen to us? Okay, will something bad, catastrophic happen to us?
What if, isn't
Yes.
it?
And it's like, every time you go out, if somebody coughs, sneezes, the anxiety is there. Are you going to catch that? Okay, so your pulse rate goes up, your blood pressure goes up,
Yeah.
your oxygen and including your glucose levels, everything go
Yeah.
up, so that you are trying to reduce or fight that cause.
Yeah.
On the other hand, the parasympathetic system is about preservation of the body, to try and bring it to the equilibrium,
Yeah.
to make sure that your body can sustain that for a longer time. So there is in a constant stress, or for that matter a sudden stress, where the body equilibrium is disturbed, and you start feeling that all in all the systems are affected, and you want to see whether you can fight it, and unfortunately some people even succumb to that also.
Yeah.
Okay, so they don't know extremes of anxiety, extremes of depression, where they start feeling hopeless. They don't know that things can get better, or perhaps given up, so to the extent of ending their lives. So
Yeah.
that can happen too. So there is a lot going on in our chemistry of the brain,
Yeah.
and both external as well as
Yeah.
internal stress, and how the body adapts to that. Okay, if you are able to fight, you are able to
Yes.
use those resources more effectively
Mhm.
and continue to stay healthy. However, if you feel, some people do feel that they can't fight it, and there may be efforts to escape, that's
Yeah.
one more adaptive or
Yes.
response which happens, or giving up at that point
Yes.
of time. So I think the basic understanding that there is a structure, a neural structure which is responsible for the anxiety, plus release of chemicals, a
Yes.
surge of chemicals which happen inside the body,
Yeah.
which helps your body to fight that. At the same time, a chronic level of stress is not good too. So which can result hypertension, diabetes, asthma, and so on and so
Yeah.
forth. So those are the things which probably are the
Yeah.
scientific reasons behind anxiety.
That's great, Dr. Madhukar. Very nicely put. So I think what you're speaking about is a very delicate balance, isn't it, between the sympathetic and what we call the parasympathetic system, and the various organs in the brain that actually regulate this. And it's not just the brain. You mentioned something about adrenal cortex,
Correct.
which is a tiny organ about the kidneys. So it's a very, very complex mechanism wherein many chemicals are released, and they have to be in certain balance whenever there is
Absolutely.
a stress.
Correct.
And I think you spoke very well about the fight or the flight phenomenon. So whenever there is a stress, either we decide to stand there and fight it when your sympathetic system goes up, or when you decide to fly away, run away from it, then also your sympathetic goes up. But soon enough you want your parasympathetic to come in and calm things down. And when that imbalance occurs, that's when a lot of people develop anxiety, isn't it?
Absolutely.
Yeah, and
You're
I guess
fighting the cause,
yeah,
and when you have good resources,
Yeah.
you will be able to handle it more
Yeah.
effectively.
yeah. But having said that, what's interesting is not all of us develop anxiety, isn't it? Because all of us have stress. Then it's only some people who actually go on to develop anxiety, and some of us don't. We are able to manage the anxiety better. So I'm guessing maybe genetic factors may be important, which means it can run in families. It also means what we have learned over the years,
Absolutely.
how we see our mummies and daddies react to stress, how we see our friends react. That also has an influence,
Yes,
isn't
the
it?
external environment
Yeah,
plays a huge role, and of course we all learn
Yeah.
from our family members, and it has been shown
yeah,
in people, obviously being brought up by anxious parents,
yeah,
then you have a tendency to pick up
Absolutely.
anxiety,
yeah,
and how you are, the upbringing plus the way events have, you have faced or you have
Yeah.
learned to face it, all contributes to the way your
Yeah.
personality does.
yeah.
So it is a combination of the genetic factors, personality factors, and more so you are learning
Yeah.
as to
Yeah.
how to handle that.
Yes.
And of course, these days you have a lot more exposure to technology too,
Yeah.
okay, which can be useful on one hand, at the same time,
Yes.
can contribute to the anxiety.
Absolutely. As long as you are able to have a balance.
Both of us would have experienced it when we were working in the UK. At least when I went, I had the pager system.
Yes.
Now, when I was doing the night duty, you wouldn't know when the pager would go off.
Absolutely.
Okay.
Yes.
So, and you have to drive in the middle of the night. It
Yeah.
could be a snow, completely snowy evening.
Yeah.
So, you don't know when you would get the call, where you have to
Yeah.
drive. And so, first few days, probably,
Yes.
you are having that anticipatory anxiety.
Yes.
And
yes.
then later, you
get
handle it
used
better.
to it. Yes.
So, I think
certainly.
you will develop, and there should be, an mechanism of understanding
Yes.
plus handling that. I think it's very,
Absolutely.
very important.
Yeah. So, and that's where I think our role as professionals come in. So, if you're faced with significant anxiety, then we are here to maybe help try and understand things, whether it needs medication, whether it needs just talking treatment, or whether it needs a combination of the two, something we will talk about later.
Later, yeah, sure.
And in relation to that, what we were going to say is perhaps we will now move on to our psychologist colleague, Ms. Suhita Saha. She works as a consultant psychologist at Cadabams Hospital in JP Nagar branch, and she will be talking to us about how to differentiate between stress and anxiety.
Over to Suhita Saha.
Hello everyone, thank you Dr. Madhukar and Dr. Priya for your introduction and insightful information. I hope the audience finds it useful. My name is Suhita Saha, I am a consultant clinical psychologist at Cadabams Group. So what exactly is stress and anxiety? They seem to overlap, they do have similarities, but they also have differences. Stress is a general reaction of a body to any kind of threat perceived. It can be hormonal changes, it can be your cardiovascular changes, it can be behavioral, psychological. There are various forms of reaction to stress. Primarily, it's basically fight or flight. It's evolutionary in nature. Whenever a body or a mind perceives threat, we tend to go into this fight or a flight mode. For this mode to happen, our bodies undergo certain reaction. The causative factors for stress can be various depending from individual to individual. What might stress me or you might not stress the third person, but the reactions are more or less similar. So when we talk about physiological changes, if you've observed your body, there are certain changes like rapid heartbeat, palpitation, shortness of breath, maybe limbs are getting cold or sweaty, various forms of reactions. Psychological can be, difficult to concentrate. When you're extremely stressful, you find it difficulty in making decisions. There's a certain amount of irritability. Behavioral is there sleep disturbance, probably your appetite decreases, or you want to stay alone, not be disturbed by others. So in terms of hormonal changes, neurotransmitters, there are certain stress neurotransmitters which play a role. There's a science behind it. That's why you tend to have this physiological upheaval in your body. You feel palpitation because your cardiovascular system is into play. You feel there is shortness of breath because again respiratory system. You tend to feel fearful or anxious. In such a situation, there is the sympathetic nervous system which is acting. This stress reaction is not a prolonged stress reaction. When there is a problem, you tend to the problem, you solve it, and naturally your stress reaction comes down. Right. That is where your relaxation nervous system, which is parasympathetic nervous system, works. It is the perception of the causative factors that causes the stress reaction. Whatever you feel is threatening will cause that stress reaction within your body. It's also very much psychological in nature, how you perceive it. If you do not perceive your assignment as threatening, it will in fact act as an enhancer for your performance. You're going to be able to look into the details of it, work on it in a better, calmer state of mind, and therefore submit or execute your project or assignment. But if it is too crippling for you, and you tend to always feel anxious, because in a workspace or in a student life, you will always have some work or the other coming up. But if your stress seems to be constant, then that is where we need to think of anxiety. When we are talking about anxiety, it is usually prolonged in nature and much more severe stress. Stress in general can be of various types. It can also be positive, which we call it as eustress. It acts as a booster for your performance. If let's say tomorrow you have an examination, you're going to study the eve of your examination because you have exam stress. But if it is too much of exam anxiety, that is where you tend to lose your sleep. You're finding it difficult to concentrate on your study material. You might not even remember because you're not memorizing it properly. So in terms of stress, again, if the stressor is taken away, your stress reaction comes down. But if you are talking about anxiety, it is irrespective of whether there is any triggering factor or not. There might be a triggering factor, which is a stressor, there might not be. But the reaction is a constant worry. It might be for the present, it might be for the future. Often it is more general in nature. It's not specific to one triggering factor. It is not an enhancer of your performance. It tends to make you feel more crippled or disabled. You find it difficult to cope with that situation, wherein you have poor coping mechanisms with the given threats that you're perceiving. Stress can be present in everyday life. For example, going to work, if your work is at a distance from your workplace, reaching there on time, reporting on time can also lead to a stress reaction. If you have a meeting, or as much as you're sitting with someone of one of your colleagues, or the environment is not friendly, or a boss whose behavior or his mood is unpredictable, that can 1 day stressor, 2 day stressor, 3 day can lead to continuous stress, which is anxiety. So you will find it difficult to even get up in the morning. You feel exhausted even thinking of going to work. This in fact can be associated with depression as well. So when we are talking of anxiety, often there is an element attached to it, is depression, which is a very commonly comorbid condition found. For example, if you're a student, you would have exam the next day. There are various manifestations of your stress. You might feel you're having a headache or a stomach ache, which is mostly somatic in nature. So for a student, the manifestations will be different from that of an adult. An adult will have more of mood fluctuations, irritation, disturbed sleep and appetite. Until unless the stressor is identified and addressed, the stress reactions will be there, but it is usually short term. But if you are talking about long term, anxiety can lead to a lot of stress reactions in a body, like you might have hyperthyroidism, diabetes. This is all with continued stress, which in fact is an anxiety in nature. You will have sexual dysfunctions, there will be mood disorders. So anxiety leads to far more serious nature of illnesses, whereas in stress you'll have dizziness, nausea, maybe a little bit of giddiness, weakness, and all those basic physiological reactions. To conclude, stress is a very natural, regular phenomena. We all tend to experience stress from time to time, almost every day. But to recap the entire process, we have to understand that when stress leads on to anxiety, this is when you need to seek out professional help. Anxiety can lead to serious physical disorders as well. To prevent that and to get yourself better quality of life is very much required. So therefore it is important to meet a professional, seek what kind of stressors or anxiety you're having in your, identify those stressors or anxiety and seek appropriate help for it. I hope you find this information valuable and useful. Over to Dr. Madhukar and Dr. Priya.
Thank you, Suhita, for the wonderful presentation, helping us to differentiate between everyday stress and anxiety. And she did talk about the common reasons.
Yes.
Okay, so
and the common scenarios where it occurs. So I think you may have understood now as to the possible differences between stress and anxiety, isn't it, sir? Stress is something we are all faced with. It's our natural life reaction. It's a reaction to life events. But when it crosses the limit and you start getting physical symptoms, it affects you, that's when we call it anxiety.
All of us will be exposed to that.
Yeah.
So you can't avoid that.
Absolutely.
That's one thing which is very, very important.
Yes.
In handling anxiety.
Yeah.
Not to avoid any situations. Okay, so everyday stress, being prepared
Yes.
for that and learning to adapt to new situations.
Yes.
School children, we all know, have gone through a lot, and that's something which children have a lot of resources and they are able to handle that.
Yes.
They will learn from the adults, so which means the adults, the parents have to support them, have to help them to deal with the anxiety.
Yeah. Yeah, children are resilient by nature, so we need to encourage them to deal with stress, particularly in times of pandemic. So when we say dealing with stress, then that takes us on maybe to the next topic, and off we go again to see what Ms. Neha Cadabam from the Cadabams group has to tell us about managing anxiety overall.
Neha is a clinical psychologist by training, and she works a lot with the children and of course with the adults too, and she would be the right person to talk about managing anxiety.
Hi, thank you Dr. Madhukar and Dr. Priya for that introduction. While we've already understood about the science of anxiety and about understanding the difference between everyday stress and anxiety, let's try and decode and understand how can we manage anxiety, both in terms of some of the self-help techniques that you can use yourself and some other techniques that can be used along with the help of a professional. So while we are trying to understand this, the first thing you need to do is try and ask yourself, try and understand, try and have that small conversation with yourself and understand where the anxiety is coming from, or identify the source of the anxiety. It could be something internal, it could be something external, it could be something that you can control, it could be something that you can't control. If it's something that you can't control, I think the easiest we all can relate to is the COVID-19. It's definitely something we didn't expect and definitely something that we couldn't control. A safest thing that you could do is try acceptance, right? Things that you cannot control, we try and work on accepting situations and scenarios rather than battling and fighting with it, right? Breathe, take good deep breaths and try and accept and try and look at the good side of what's been happening. What you can also do is mindfulness techniques. It's something that works very, very well. It works even in your day-to-day, everyday stress. Mindfulness is nothing but being mindful of the moment you are in. I am here right now doing this, maybe just having a meal, maybe just sipping a cup of coffee, maybe just taking a stroll, maybe just working. Try and be in the moment. Don't ponder over the future of how 2021 ahead will look like or go back in the past in terms of what went by. Just try and live in the moment and try and focus on that. If it is things that you think you can control, see if you can work that out and if you can sort it out. But it could be something that you may not be able to sort it out immediately. So what can you do then? You can try and use deep breathing techniques, right, where you try and just take a moment, take a break from what you're doing and just try and take good deep breaths. It's like yoga. It's something that's going to help you on a day-to-day scenario and help you make you emotionally and mentally stronger, right? Some of the other things that you can do is try and understand your thoughts. Is it something that you feel you're thinking negatively? Are you thinking positively? And try and see if you can reframe it. Is it some irrational fear that you have or a belief that you have? And try and see if you can sort of tweak it to make it work in your favor. Right. So these were some of the self-help techniques that you can do. Along with this, what you can also do, something that's always worked for me, is connecting with a friend or connecting with someone whom you think you can speak with. Try and talk to them about it. Talk to them about how you feel. It's okay to have bad days. We all have. You have, I have, and I'm sure all of us do. Talk to them about it. What you can also do is something that can work on a day-to-day basis is doing things that you enjoy doing, right? It could be playing a sport, dance, listening to music, taking a stroll in nature, running, absolutely anything that you think you may enjoy doing. Engage in art, that could be another thing that you could probably look at doing. Some of the other professional techniques that you can use with the help of a professional. Now, before I get there, I want to talk to you, if you are experiencing a lot of anxiety and if you feel it's very overwhelming and you're finding it difficult to cope with, do not hesitate to reach out to a professional. Today, it's not so difficult to reach out to a professional. You can go, or you can even take it online. You have many options, and do not hesitate to reach out to a professional. So, one of the techniques to start off with, something that you might have already heard of, is CBT, also known as cognitive behavior therapy. Cognitive behavior therapy is nothing but a technique in which, along with the help of a therapist, they will help you identify your irrational fears or your thinking patterns, unhelpful thinking patterns, and they'll help you how you could sort of tweak it to make it work in your favor. So, CBT is something that's definitely practiced across the globe, and it does very well work with anxiety and even panic attacks. Moving ahead, JPMR is also known as body scan, is a famous relaxation technique that can be used. It's called, to break it down, it's called Jacobson's progressive muscle relaxation or body scan. You will also find scripts of that's online that you can try and use for yourself. It's also a wonderful way to help you relax with your physical symptoms especially. Exposure therapy. Now, let's say it's something that you think you are really fearful of. Try and use exposure therapy, which is gradual exposure to something that you're very fearful of or anxious about. Okay. Another thing that that works very well with anxiety is biofeedback. Now, biofeedback is where, now what happens when you are anxious? You have your physical symptoms, right, which is your increased palpitation, feeling breathless, feeling uneasy. So, in biofeedback, we try and use various techniques in which we try and help you, ease out your muscle tensions. So, basically your physical response that it's there, we try and work with that and we help you work, and it has a great efficacy when it comes to working with anxiety. While we are talking about anxiety, I think it won't be fair if I will not talk to you about panic attacks. Now, what is panic attack? Panic attack is something where, to be honest, it's actually very similar to a person who may have a heart attack, right? You're feeling extremely anxious, you might have pain in the chest, you may feel very uneasy, and it can happen at any time. It lasts from 5 minutes to up to 20 minutes. Something that can work very well with someone who may be having a panic attack. If you want to help someone who may be having a panic attack, try and work with the 5 senses, right? Ask them what they can see around them, right? Ask them what they can feel, right? Ask them what they can smell, something that they can touch, maybe they can even grab something that make them feel good. So, try and work with them with the 5 senses, talk to them, ask them what they can see, what did they eat for breakfast. So, you're basically moving the person more from the feeling to the thinking mode, right? That sort of helps them ease out and get them to really relax very, very well, right? Also, ask yourself if you are a worrier. A worrier is nothing but someone who's chronically worrying about everything. What about this? What about that? How is this going to be? How is that going to be? If you are something who are a chronic worrier, identify it and get professional help. The earlier, the better, because we will be able to help you in the best way possible. So, as a caregiver, if you know someone who has been going through anxiety and having panic attacks, you as a caregiver, something that you can do, or if you are going through yourself, something that you can do yourself, the first and foremost, try and identify what your triggers are. Is there one person, is there one situation, is there one thing that really triggers you and makes you anxious or probably have a panic attack? If so, try and see what those triggers are and try and see if there's something that you can do about it, right? So, like I was talking to you about the 5 senses, you could carry you can use your sense of taste. So you can carry a chewing gum, a mint, right, to sort of help you ease out. That's also something very small like that can help you. Carry some photos, carry some videos with you on your phone that immediately that can help you. Please don't go on YouTube and browse how to reduce anxiety when you're feeling anxious. That's the last thing I'd want you to do, because it's only going to make you more anxious. And if you are someone who's been battling anxiety for a long time and is someone who's prone to have a lot of panic attacks, do regularly visit your therapist and your psychiatrist, who are able to monitor your medication and to make sure that you're able to handle it in the best way possible. And as a self-care, do some exercise, eat healthy, sleep well. And also very important to try and see if you're engaging in healthy coping mechanisms or unhealthy coping mechanisms. Unhealthy coping mechanisms would be a lot of caffeine, alcohol, nicotine, and I would say definitely stay away from all of those, or even procrastination and pushing things that you would want to be doing. Some of the healthy coping mechanisms, like I mentioned, eat well, eat healthy, exercise, reach out to someone. These could be some of the things that you can do to sort of help you cope with anxiety. Monitor yourself, right? Let's say you've had an emotional outbreak. Trust me, your body and mind will give you signs much before that outbreak. Identify those signs and respond to it that time, rather than allowing it to explode and making it really hard for yourself and people around you. Thank you. I hope you found this information of managing anxiety, a few DIY techniques and a few other treatment options helpful. Now let's go back to Dr. Priya and Dr. Madhukar, where Dr. Priya will be talking to you and educating you about some of the treatment options that we have for anxiety and panic attacks. Thank you.
Thank you, Neha, for the presentation and helping us out in understanding how to manage anxiety.
Yes.
I think a lot of people would be interested to know from this psychologist. We as a society still have certain reservations about medications.
Yes.
Okay, but the psychological techniques are effective, equally effective, and will help you to handle the anxiety over a long period of time.
Yeah.
So this is where I think Neha's topic on identifying what could be the trigger factors, what has led to the maintenance of anxiety, how you handle it. And she's talked about different types of therapies also.
Yeah.
One thing which we have to remember is, it's not as if one therapy is better than the other.
Yeah.
They are all equally effective. It all depends on the way a person is tuned to.
Yeah.
Okay, and some may be finding it useful as yoga. Some may find it useful to go through music therapy. At the same time, the normal exercises, or even sharing with. So all therapeutic techniques have the basic principles of being able to recognize the triggers, keeping the body under control, as in less arousal, so that you are able to handle the triggers.
Yes. Yes, that was a very useful talk by Neha. And I think finally, last but not the least, we are going to be talking a little bit today about treatment of anxiety disorders from a psychiatrist viewpoint.
Yes, Dr. Priya is going to talk about the management of anxiety. We have heard the psychological therapies, and I think it's equally important that pharmacotherapy or medical management is given due importance.
Yeah.
They are effective, more so in immediate situations. I think we all know just before exams, or there are some people before catching a flight, or maybe such instances where you need immediate instant relief. So I think that is where the medical management comes into play, and no better person than Dr. Priya to talk about it.
Yeah. Before we go on to talk about treatments overall, I just wanted to make a small distinction, just in case our people are not aware, between a psychologist and a psychiatrist, because this is something we get asked about very frequently. Psychologists, as you know, they focus mainly on talking treatments, like how Neha spoke about and Suhita spoke about the various CBT, cognitive therapy, exposure therapy and whatnot. Psychologists focus mainly on talking treatments. They focus on the thinking patterns, behaviors, learned processes over the years, so you can try and use them in situations in your life, anywhere at any point in time. Whereas we psychiatrists, we provide that holistic view. So we talk a little bit about psychological treatments, but that's not our main forte. Our main forte lies in providing medical treatments, be it in the form of various tablets, how to combine different tablets, and we are good at deciding which tablet to give whom, depending on various things like the severity of symptoms, how good their physical health is, what other treatments they have taken. So we are able to give the overall view when it comes to medication and a little bit about psychological treatments as well.
I agree with you. Just to add on to the points what you mentioned, our role is also in identifying the causes, particularly the medical causes which could be contributing, and we will be basically we are doctors, medically trained, so we have to look at the physical causes, of course due importance to the psychological factors which may be contributing to that, and without a doubt the prescription of medicines are our responsibility, and we have to manage that.
Absolutely. So when we are talking about treatments for anxiety disorders as a whole, so when I say anxiety disorders, there are different types of anxiety disorders. I'm not going to go into details about all of that, so, but as an example, some people may have a specific anxiety for specific situations, for example using a lift, when we say it's a specific phobia, whereas other people with anxiety may have anxiety for anything and everything around them. It could be for small day-to-day decisions, it could be for big decisions, it could be to decide what they want to eat, what should they take tablets, should they not take tablets, and that can be accompanied by a lot of unrest, fatigue. It can, and untreated anxiety can also sometimes lead to complications like a depressive disorder. So it's very important that we look at treating anxiety disorders if necessary, and when I say if necessary, what that means is if it's a very mild anxiety disorder, which is what many people in the community may have, simple talking treatments or even self-help therapies may help. But let us say there are other factors which we need to consider. For example, if it's a mild anxiety but it's going on for far too long, it's not getting any better, they are not able to use self-help therapies, or if the symptoms are very severe, they are not able to function because of it. Let's say, how many patients have we seen, Dr. Madhukar, where they are so anxious, they are so stressed, they have pins and needles in their hands, or they can't swallow, they've got churning in the stomach,
severe
they are not able
anxiety.
to, they have concentration problems, they can't work at work, they are not doing well, bosses are pulling them up. So if it's accompanied by significant, what we say, functional impairment, then we are looking certainly at medication management as well. So the other thing that also matters is the state of their physical health. Let's say they've got significant anxiety but physical health is not that good, they are very elderly, then we may be looking at talking treatments first. So what I'm trying to say in a nutshell is what kind of treatment we decide will depend on a host of these factors, isn't it? But when we are looking at treatments as such, medication as such, we are looking at a very commonly used type of drugs, antidepressant drugs. We use them for anxiety as well because the chemicals involved are the same. So what we are looking at is what we call SSRIs, which is a group of commonly used drugs, isn't it, Dr. Madhukar? There's many SSRIs, many people may recognize what they are using, be it sertraline, fluoxetine, escitalopram, citalopram, paroxetine, isn't it, Dr. Madhukar?
Absolutely.
There's all these drugs, many other groups. You may recognize what's called SNRIs, in which we have venlafaxine, we also have duloxetine. There's other groups where we also have drugs called mirtazapine, etc. So many antidepressant drugs to choose from. The way they act is they bring about some chemical changes in the brain, they reset the chemical imbalance which is causing a lot of anxiety symptoms like stomach churning, low mood, crying spells,
Absolutely.
suicidal thoughts if untreated, suicidal actions, unable to work, unable to concentrate, tiredness, etc. So the tablets will help in improving a lot of these symptoms, so you're able to get up, function well. But there are also many occasions where improvement in these symptoms alone is not enough, and it needs to be accompanied by talking treatments, so you can apply them for later in life as well.
Couple of things about the medication itself. What you mentioned about SSRIs, they all do take time. I think it's very,
Yes,
very important.
absolutely.
Now, these are not for self-medication. It has to be seen by a qualified psychiatrist
Yeah,
who has to go through a proper medical history
yeah,
and anything which could be contributing, as I said, investigations. And then when you start, we also have to understand the medicines itself can make you anxious for a few days before
Yes.
it starts coming down.
yes,
And along with the SSRIs, or perhaps the older ones, the tricyclics, for a short period of time one may need even benzodiazepines.
Yes.
Now, if you look at elderly population, there are a lot of them who take tablets for sleep.
sleep, yes,
Okay, and sleep, as we all know, could well be one of the common manifestations.
Yeah.
Sleep disturbance as anxiety. So people who take Compos, diazepam, let us remember it has to be prescribed under medical supervision, taken for short duration, and when prescribed for the right
yeah,
cause or reasons, they are very,
Yeah.
very effective.
yeah,
There are effective treatments available, but it should be done under medical supervision, and you need to give sufficient time for it to start working also.
yeah,
And then as you mentioned, to take care of any side effects, to monitor them closely, and if
Yeah.
one doesn't work, there is always one more
another,
to be
yes,
prescribed.
yes. So as psychiatrists, we are able to have that plan A. If this doesn't work, we do plan B, plan C. It's all evidence based, isn't it? And we also take into account the physical health of the individual. But one thing, interesting, you mentioned side effects. So as Dr. Madhukar said, yes, it causes a bit of anxiety in the beginning, but in general, these drugs are generally very well tolerated. Mild side effects, if at all. Having said that, which drug doesn't cause side effects? All tablets
very
under the
true.
sun, yeah, isn't it? So that way these are pretty well tolerated, but as Dr. Madhukar rightly said, it has to be supervised by a professional, by an expert in the area, because we are able to monitor side effects and change the drug if necessary to something that's more suitable, something that's more appropriate. And here comes the concept of Googling, then Google doctors. I mean, how many patients now? It's very good. Google is excellent. Everybody Googles everything. But it's still important to come and approach us about the doubts that you have from Google, isn't it? Because when you look at Google for a particular drug, there's 1,000 side effects that's mentioned, and then you don't know which one to pick and choose from. So it's very important, although that information is available, you need to know which one to filter out and which one to actually take into account, and for that you will need to approach the experts, isn't it? It's like doing chartered accountancy.
Yeah.
I mean, if I Google, I can find out everything about taxation, but I don't know what applies to me, so I still need to go to an expert. So it's very important to remember that doctors are here for a reason,
And
isn't it, Dr.
one more
Madhukar?
thing which, since you mentioned Google, a lot of youngsters, for various reasons, do search, and we also know that there is a significant population who do try out drugs, various things, maybe alcohol, nicotine, cannabis, and so on and so forth.
Yeah.
Now it's important to understand that when you take these also, there is always a tendency to get habituated, dependent on that. And likewise, when you are trying to fight it, come out of it also, you may need help.
Yes.
So which can be again a reason for anxiety.
Yes.
So it's important to understand medications are available.
Yes.
Their safety has been proved all over the world. they are widely used. So talking to a professional will help allay your anxiety, will give you the proper information, and when used in the right indications, they are very effective treatments. And it's important to understand there may be reservations in a lot of people who prefer talk therapy. I actually look at it this way, that when you have something as an anxiety, being on medication for a short duration will help your compliance, will help you to go through the psychotherapy for your own good.
Isn't absolutely, because if you're going to go in for talking therapy, you need to be able to understand what the psychologist is saying, what are they trying to convey, and for that it's very important to be able to focus, to be able to pay attention. And if you can't do that because of your anxiety, then it's important to consider tablets, so you reach that level, you can pay attention, you can focus. So these are all some of the reasons why we need to consider medication as well. And if you look at evidence base, as Dr. Madhukar said, tablets and talking treatments are on par with each other. So we would need to tailor the treatment to the needs of that particular individual. And the other thing I would like to mention, one thing is the addictiveness, and we get asked about it quite a lot. Are these tablets addictive? The antidepressants which we use per se for anxiety, they are not addictive. But the short-term drugs which you spoke about, if used in the long term, yes, they are addictive. So again, that is something we help our patients try and wean them off them, so they are not on addictive drugs, and in fact switch on to more safer drugs. Isn't it, Dr. Madhukar?
Absolutely. I think it goes back to saying that one has to be under the care of the professional. I strongly oppose any self-medication.
Yes.
Okay, and continuing the prescription without talking to the psychiatrist, certainly you are doing more harm, so one should not do it. So thank you, Dr. Priya, for talking about the management of anxiety. And from what I understand, it's something which is a very common condition. Clearly you have different ways of overcoming the anxiety. It helps you to understand there are both medical management as well as psychological treatments for anxiety, and seeking a professional help should not be delayed, because the earlier you seek, you are going to get better, you will be able to overcome that and do well, because it could well be hampering your studies, work, relationships, and so on and so forth. I think one should not hesitate to seek or contact a professional to overcome that, and you will be able to choose whether you want medication or psychological treatment. The choice is yours, but clearly one should not suffer. So thank you once again for talking us through about medical management.
So thank you very much for that lovely conversation, Dr. Madhukar. I hope it was very useful for our audience as well to recognize symptoms of anxiety and to have a little bit idea about management, be it with tablets or about the talking treatments. If you have any, you can actually type us the questions on your chat box, and Dr. Neha will be ready to take them for you. Many thanks.
Thank you very much.